All right, Kelly, thanks so much. Well, it may sound like a broken record, but COVID cases here in Indiana continue to go up. For the fourth time in a week, our state has reported more than 2,000 COVID cases, 2,500 of them yesterday alone. Indiana's 7-day average positivity rate is now at 9.3%. Remember, the goal was to stay below 5% in positivity rate to open things back up in Marion County. Marion County's 7-day positivity rate is now above 9%. Over in Boone County, COVID restrictions are starting to ease up at the county jail. Last month, dozens of staff members and inmates tested positive. That forced the sheriff to reinstate COVID policies, including a quarantine. Now we've learned that the jail is free of COVID. Some restrictions are still in place as they monitor the health at the jail.
A high school football team is now having to cancel their schedule because of COVID. Unvaccinated players in Martinsville, along with their coaches, have started a 10-day quarantine. This started earlier this week for JV and varsity members after several positive cases on the team. They canceled the scrimmage versus Columbus East. They'll also move its home opener against Bedford North Lawrence to August 21st.
And a Brown County school is now closed for the rest of the week after multiple students there tested positive for COVID. More than 60 students and staff at Helmsburg Elementary either have COVID, were considered close contacts, or were absent with possible COVID symptoms. That hit the threshold of 20% of the school population to move to remote learning for 3 days.
I just hope that this break from school allows everyone to get back on track and really think about what's important, and maybe if a child needs to miss a day of school to save everybody else's.
That school there in Brown County is now undergoing a deep cleaning. Students and staff will return on Monday to in-person classes if there are no more new positive COVID cases.
Well, the CDC's new vaccine recommendation for pregnant women are now making headlines. This comes after months of discussions with doctors about what expectant mothers should do during this pandemic. We talked with one local mom, Savannah Moore, who says she didn't get the vaccine so that she could have control of her own pregnancy. Well, she ended up in the hospital with COVID more than a month before her due date. She says now that COVID was actually in control.
When my OB came and said, we're going to have to put you on the ventilator and deliver Delaney, I was saying, this is not her fault. If anything happens, save her. I was like, Mom, I should have got the vaccine. I should have got the shot.
Wow, looking back now, Savannah says she wishes she'd taken the vaccine while pregnant, and she's not alone. According to the CDC, only 23% of pregnant women in the U.S. have actually gotten the COVID vaccine.
So why are pregnant women at a higher risk? Well, basically it comes down to the changes in women's immune systems.
A mother's immune system is suppressed for a purpose because you're growing a baby. So any respiratory illness is harder on a woman who is expecting.
Your heart and lungs change and are actually working harder because you're not only pumping blood and breathing oxygen for yourself, but you're now doing it for your unborn child.
So it's not that you're at a higher risk of getting COVID, it's that you're at a higher risk of getting any kind of serious illness if you catch COVID. Well, we have a special section dedicated to COVID-19 and the vaccine on our website. There you can see the updated cases for the state and your county specifically, plus more information about the number of reported COVID cases your child's school might be reporting.